So, very good evening to all of you. Yes, the sound is coming. The sound is coming. Actually, the person who sees this has, he told me that everything is fine. Audio fine, he told me, and then then he told audio is off. So anyhow, so okay, I am very sure that now you can hear me. Yes, now I think I'm quite audible, and you must be able to hear me now. So my point here was, let me start from the first. So at this point of time, when many of you have just come up from the last year's, maybe I not say exactly failures, but you didn't get a rank of your choice. So that was a not exactly a success, but that should give you a stepping stone at how you should go up of now. At many point of time, you will feel that you're not exactly able to perform to your maximum potential. So I really believe that it is important for you. You will find a way. If it is not, you will find an excuse. That means at this point of time, if you really are wanting to do good, you will find a way. Maybe you will study more, maybe you will take a time out, maybe you will make a different plan schedule. But if you feel na is baar to nahi ho payega, then you'll definitely move on to finding an excuse. So make sure that you are the one who actually find a way, and not the ones who actually are looking for an excuse not to study. So I'll just share with you a few things, a few things that uh, actually is being asked to me in this point of time. So I was being asked a few things, sir. What is happening to me nowadays is I'm making a plan, and in that plan I'm not able to exactly finish the things that I actually have planned. Now, the two types of messages like that come in this way. One are those who have made a plan and are quite behind them. For example, they had made a plan of 3 days of medicine, 3 days of surgery, 3 days of pathology, 3 days of pharmacology, and what they are now seeing is the 3 days may they're only doing half of the subject. But a few of them who are able to finish it almost, but are just jumping up for one more day. Now, please understand one point, that if you're giving 3 days to a subject and you're not able to finish even half of that, that means your planning is not correct. So make your planning right now, because this is the time that you should make a good plan in a way that you can revise at least once before the INI comes up. So my point here is that your planning should be in a way that suits you. You don't ask others that what is your plan, guy. Just you don't ask your friend, show me your plan. I just evaluate the same, because maybe your friend has read a subject very well and you might have not read it at all. Your friend might have read pharmacology very well and you might be very weak in pharmacology. So make sure the plan is suiting to you and not to your friend. Okay. Now, at this point of time also, again, you don't want to look back and be known that you could have done better. So every night you sleep now, every hour you spend now, make sure that is the hour that you want that to be. You want to study a lot, Make sure in this hour you'll study a lot. You want to revise that subject in this hour, make sure you revise that subject in that hour. Don't waste any time. So what happens sometimes is, like when I was preparing, I'll share you with my story that when I was preparing, what happened was, uh, I used to study, and then suddenly a different thought actually came to my mind, and I was completely distracted, so I didn't know what to do. What happened was, I wasted a lot of time doing that, and eventually I realized that actually I am actually sitting for 10 hours or maybe 12 hours, but the output coming to me is just 4 or 5 hours, because any other time I was thinking of what may go wrong, what are my friends doing, what might be others doing. So what I did was, whenever any extra thought came to my mind, I just stopped studying, I just stopped reading, I closed my book, and I thought about those things, those extra things completely, to the extent that that extra thought actually stopped coming. That actually helped me a lot. Eventually I was able to study for 10 hours, and my output was actually around 7 to 8 hours. And then when I increased at the last to say 14 hours, study in the last, everyone studies for that time amount. Let's be very very open about it. So when I then increased my studies to say 14 hours, my output was really 10 hours, because that extra time that you actually waste thinking about any other thing that's not important, it actually is very very dear to you. So guys, yes, I think the sound is okay now. So the only way to do great work is to love what you do. And actually, what I'm doing is, I actually love teaching you all. I'm very passionate about it, and therefore I just actually do that. Uh, Guys, if you have any doubts, do let me know so that I can actually start the session. In the meanwhile, I will just try to give you a basic plan and a basic outway as to what you must do. Dekho, about the grand tests. So I'm also getting few messages that, sir, in the grand test, I'm not able to score to my whole potential. Well, you know what happens? A grand test is a good way to assess yourself, but it's not a good way to judge yourself. What I'm trying to say here is, because what happens sometimes in a particular grand test is the question is so long that you're not mentally prepared for it. One more thing, because when we were giving a grand test, we used to go to a center and take a paper and pen and used to write it down. At the time was 10 a.m. to 1 p.m. When you give a grand test, what is the time that you select? Sometimes what I'm seeing is, sometimes some of my students are giving a grand test not in the full attentive mode, but they're giving a grand test when they don't want to study, or actually they have just exhausted them to study. So if you're giving a grand test when you've already exhausted yourself, you will definitely don't want to give a grand test. You don't want to make a question correct. So choose a time of our grand test that actually suits you the most, that actually you are most attentive and you are the most fresh of your mind. So it's not a good habit to give a grand test when you're almost asleep at around 11 o'clock. Just start giving a grand test when you're not actually very awake. So try to give a grand test in the best of your time. Suppose if you ask me, sir, when you get to give a grand test, I will say that if you have just woken up after sleep, maybe for half an hour, if you're taking a power nap nowadays, it's the best thing to do. So just give a grand test after that. Okay, and don't give the grand test in tits and bits. That means you start a grand test and finish it off. Now, coming up to if you're attending a grand test, and then you basically have, now you basically have how to go through the explanations. Now again comes a question. What happens, that a grand test has so big explanations. Kitna padhoge na? How much will you study? Suppose if I give you a question, suppose my question is folate transporter gene is on. The answer is chromosome 21. Well, whether you know that or not, how does it matter? If the suppose the same questions comes to you again, you must know the answer. I agree to that. But how does it matter that another gene is on which chromosome? That means explanations sometimes are completely wavered. They give you everything about whatever they know in the explanations part. And what you do is you are completely like this. Are Baba, I didn't know this. I don't know this. I don't know this. Now what to do? So make sure that explanations are only up to the point and you don't read the entire explanation. That means if you give a grand test, it is very, very important to know your mistakes. It is very, very important to understand where did you go wrong. But it's not at all important to read the complete explanations from top to bottom. If you find a information which is completely factual, ignore it. Ignore it, I'm telling you, ignore it. What many students are doing nowadays is they're giving so much time to the revision of the grand test that they're not able to revise their own notes. Now tell me, how do I have you attended my class, or have you attended any other faculty class? How do they actually give their notes? So what we do is we take the previous year questions and we know what questions have come. Then we try to put that question not in a factual form but in a conceptual part and give it to you. That means if you revise your notes very well, your half of your work is done. Okay, so rather than revising a grand test again and again, just look at the mistakes, make sure you don't do the mistake again next time, and put that important point in the notes. That's it. Okay, that's it. Okay, and finally, you have to work hard till the next time. You don't need to introduce yourself. We will be introducing you. The he is rank 1, she's rank 1, he is rank 2, she's rank 2, whatever rank you get. You get rank 200, get rank 1000, but you get a seat of your choice. You are the topper of your own mind. So that is what, work hard until you no longer introduce yourself. Basically, this session is going on to be more to a motivation session. I wanted it to be more of a interactive session. You ask me some questions, but I don't see any questions right now. So I'm just going on and on. Maybe some of my words will maybe motivate you to study more and more, because that is very important right now. Okay. So, okay. Now, coming up to the next part, that is how to revise a subject. How to revise a subject. See, now if you ask me that, sir, please give me a way how to revise any subject. So what I'll do is I will just open my notes once. Suppose this is my notes. Okay. Now, in every notes, you will find that there is a point in which you yourself have made a box, or you have made a question, or the faculty has made you to make a question. Okay. Now, the point is, when you were solving a question from that topic previously, maybe some of you have written some MCQs on the left side of this. Some maybe you have written a small points here and there like this. You'll be surprised to know, even though I'm not demotivating them, those who have solved them. So my point here is, I've talked to lot number of students, and what they say is, sir, ultimately what you write for us in the notes is what we remember, and is what actually the question asked from. So what usually you do is you write so many information in the notes. It's very good, very good. But actually, don't forget the main notes we have given it to you. Okay. So don't over pressurize yourself by revising it again and again. Just pressurize yourself to revise the notes, and especially those parts which a faculty has made you to write. This was a previous question. This is the most important part and you should write it. Sometimes we get in a different mode and tell you this will be a question. So because we have been seeing the questions for last 5 6 years in the same subject, we actually get to predict what may come. So that is one thing that you can do. Okay. Robin's 10th edition, there was a very few updates from Robin's 10th edition. I also have shared that in my own YouTube channel, and the same will also be updated in the eGurukul of my own app. So if you actually want to go through the few 4 or 5 updates that have actually come, there's not lot number of updates. A few updates that actually have come in the topic wise. I've already shared in the YouTube, my own YouTube channel. You can see it there. I also uploaded the same thing in the Bhatia channel. You can see it there also. And eventually the same thing will also come up in the eGurukul app, maybe in the next week. You can watch it from there also. Okay. Because there's not a lot number of updates, especially because hematology was one thing that needed a lot of update from Robbins. But eventually, as you already know, I always teach hematology most updated information. So I actually gave you the 2019 updated classification in the hematological classification, so which actually was updated in this Robbins 10th edition. Okay. In tumor immunity, the tumor cells does not exhibit MHC to escape the T cells immunity. Won't the NK detected as a foreign cell? Yes, it can. So yes, Praveen Kumar R, it may happen that देखो क्या होता है ना, sometimes that suppose this is a tumor cell, okay, tumor cell. So if a tumor cell, as you already told me, it has a MHC1, okay, a tumor cell having MHC1. So this MHC1 can be destroyed by the CD8 T cells. Okay. Now what you are asking is, suppose this tumor cell doesn't have the MHC1. Okay, so what may happen? The NK cell can destroy it, correct? NK cell can destroy it, But you know what happens? The NK cell, to destroy any tumor cell, the NK cell should have a activating receptors. So actually, NK cells have an inhibiting receptor and NK cell also have an activating receptors. So if the tumor, if the tumor activates, the NK cells, then the NK cell will destroy the tumor cells. Else it will not destroy the tumor cells. So what is haploinsufficiency and dominant negative inheritance? Look, what happens sometimes is, it is like in autosomal dominant inheritance. Look, what happens is, let's assume a collagen. Okay, a collagen. So collagen, as you all know, is a triple helical structure. Okay, this is one helix, this is a second helix, ऐसे. Okay, and there's a third helix like this. Okay, this is the structure of collagen. Okay, now as you understand, the three helix of the three fibrils of the collagen, they should have come from the three different genes. So I can say they might have been synthesized from the gene A, gene B and gene C. Okay, now देखो, what happens sometimes is, let's assume that if there is a mutation in gene A, ठीक है, let's assume there is a mutation in the gene A, तो क्या होगा? If there is a mutation in gene A, क्या होगा? That this gene A, it should ideally, please understand, it should cause decreased collagen. Exactly, because one of the gene is not there, so collagen amount should be decreased. But do you think that is the only problem? But due to the absence of gene A, it also causes structural abnormality in entire collagen. And this causes a big problem. It causes a major defect. For example, look at the osteogenesis imperfecta. In osteogenesis imperfecta, there's a problem in the collagen genes. So if the problem is in collagen genes, the amount of collagen should be decreased. But what happens? An abnormal type of collagen is formed, and which will cause a big clinical problem. It will lead to a severe clinical features. And this type of inheritance, where the mutation of one of the gene causes a different type of big problem, is called as dominant negative effect. Okay, dominant negative effect. समझ रहे हैं? So dominant negative मतलब, इससे वापस समझो. So suppose एक simple example समझो. There's a chair. Okay, there's a chair. This is a chair, right? Okay, I'm just drawing a chair right now. Okay, this is a chair. There are four chair है ना? Okay, there are four legs to the chair. There are four legs, leg A, leg B, leg C, leg D. Now suppose leg A is not there. So can you sit? No, the entire chair will fall. So suppose the chair leg A is not there. What must happen is, the chair should be weak, but not possible. The chair will not at all stand there. The same way, the absence of some of the genes causes a big problem, and the big problem is called as dominant negative effect. Okay. Okay. If you haven't watched the full videos of the subject, LMRP is enough or not? Dear Pallavi, LMRP is last minute revision program. That means, so what I have done in my LMRP is, I have taken most of the images from my basic classes. Okay, so I have taken those images and have tried to put that in the easiest way for you. That saves a lot of time. So what I've tried to do is, my 60 hours of regular classes of the pathology has been decreased to just 12 to 14 hours. Now if you ask me, are they enough? Well, because I have made it, I will never say it is not enough. But what I'll say is, you may not get the concept, but if your concept is correct, if your concept is right already, then I think LMRP is enough. That means in the regular classes, we build optional subjects. We start with general pathology, we move to hematology, the hematological malignancies, the cancers, and we then move to the individual diseases like the liver, like the kidney, and all those. But if there is a problem in the conceptual understanding of subject, then I think the better way is to go through the full subject, not the LMRP. Okay, so most of the time, if you have any problem in identifying any particular HNE slide, do let me know so I can discuss for you. High yielding question for December FMG exams. So I think we can have a different session altogether for that, so that I can take all your queries in there only. But I think right now what we can actually focus on is this discussion on the PG exam that is coming up. Okay. So if you have any particular HNE image in your mind, to let us know. Let me know. I may be able to sort it out for you. Okay. So, but by that time, please make sure that you study well. And LMRP is a very good way. I'll say it's a very good way to study. Okay, how to integrate subjects? See, it depends upon which year you are. Which year you are. Well, integration is best in the final year MBBS. Okay? In internship, the time is less. So yes, you may try to integrate, but the best way to integrate, best time to integrate is the final year of MBBS. So if you're in final year MBBS, that's the best question for you right now. So suppose you are maybe studying any topic. Let's assume that you are studying a GI topic. Okay, so in the GI, take your pathology back. Try to read the hepatitis complete, hepatitis pathophysiology. Try to read the diagnosis from Robbins, and then try to read the treatment from Davidson, or maybe from Kundu, or maybe from Harrison if you are quite studious enough. Suppose you're reading cardiovascular system, so try to read the right heart failure or the left heart failure, the cardiac arrest, myocardial infarction from the pathological aspect, and then try to read the treatment aspect from the pharmacology, and then try to read the complication from the medicine part of view. So don't try to read the pathological aspects from medicine. Don't try to get the pharmacological aspects from medicine, because that will be very long time. It will take a lot of time, and you may eventually waste a lot of time. So genetics may important topics. I think genetics may, if you talk about genetics, I will say genetics may pedigree is very important. Solving a pedigree is very important, because you always get a question from this. Examples of inheritance pattern, again very very important. And non-Mendelian inheritance pattern. So I will say these are the three most important from my point of view. Okay, PSC and the PBC differentiation. Okay, good question. So you're now asking about the PBC and the PSC differentiation. Okay, but I'll first tell you. Now suppose you take a liver biopsy. Okay, you take a liver biopsy. Okay, so in the liver biopsy, suppose you are getting a bile duct. If you're seeing a bile duct, suppose a bile duct hai. Okay, now see, if there is an amount of fibrosis inside the bile duct like this assay, a concentric laminations in around the bile duct assay, it will be primary sclerosing cholangitis. But if you see a lot number of lymphocytes in and around the bile duct like this, to an extent that you're not able to actually see the bile duct, this will be finding of primary biliary cirrhosis. So PBC and PSC are very different. I'll try to show you that image on the Google. Let's see if you can actually get to know that. Now, if you're actually asking about the INI CET from the LDH में LDH type 1 and 2 होता है, ठीक है? INI CAT from the updates, just focus on the concepts, guys. Try to understand the conceptual understanding rather than just straight away looking into the questions like, there won't be a question like, programmed cell death is, and you write apoptosis. But the question can be, there was a chemotherapy, a chemotoxic agent given to the patient. The patient has decrease in the tumor cells. What may be the pathophysiological change occurring in a tumor cell? And the answer is necrosis as well as apoptosis. Okay. Anyhow, I'll show the image from PBC and PSC. I'll just show that. देखो, I'll first show you. Let's Google it up. Primary biliary cirrhosis histo. Okay. देखो. So what I told you is there must be the finding that you see a lot number of lymphocytic infiltrates. Like look at this. देखो. You see the lot number of lymphocytic infiltrates. Look at this. So if you are seeing lymphocytic infiltrates huge number, it becomes primary biliary cirrhosis. Okay. Let's see one more. Now if I show you the PSC histo, I told you there should be a onion skinning like pattern. So like look at this one. Look at the round collagen proliferation. It is the primary sclerosing cholangitis. The second year eGurukul are helpful in second year profession. Obviously, that is a backbone. Okay. Don't try not to watch the videos of pathology. Never ever try to ignore it. Okay. For 10th updates, just look at the videos I have already put on my YouTube channel as well as on the Bhatia YouTube channel. Every update is there. No further update is required. If you want to solve an MCQ books, try to take either my book. It comes from my own name, Dr. Praveen Kumar Gupta. If you can just Google it up, you'll get my name in an MCQ book and you can take it from there. I'm very good. Thank you, Bhargav, for asking me that. I hope you two all are very fine. So I think it was very good session talking to you all. I don't see a lot of queries, so I'll just close the session with a last question. Can you say something on the points on Pegler Huet cell and Dohle body? So Pegler Huet cell, it's because you're asking Pegler Huet, not pseudo Pegler Huet. So Pegler Huet is actually a neutrophil which has bilobe, two lobes. I'll just Google that up also. देखो, Pegler Huet is a bilobe neutrophil with less number of granules. Pegler Huet neutro. Okay. So in this thing, you will find a binucleate neutrophils with less number of granules. It actually is a dysplastic neutrophil. Dohle body is actually what? Dohle body is a endoplasmic reticulum coming up because in a patient of sepsis you find it. Thank you, Yash. To find MBBS, again, please understand that unless you don't know pathological reasoning of a disease, you will not be able to get the conceptual understanding of a final year subject. So make sure your pathology is very strong before you start reading the final year subjects. Okay. So flow cytometry, it itself is a long topic. I cannot take that right now. But warm and cold immunohemoglobin anemia. So warm में there is a IgG antibody, okay, and cold में there is a IgM antibody. So what happens? This IgG or the IgM antibody, it means that they're active at 37 degrees Celsius and 4 degrees Celsius, or it can also be at 22 degrees Celsius. Okay. So what happens? This antibody causes destruction of the RBCs. Okay. If it is due to IgG antibody, we call it warm antibody. If it is due to IgM antibody, we call it cold antibody. And you already know the examples. Okay, liquid based biopsy and liquid based cytology. Liquid biopsy and liquid cytology is a bit different. Liquid cytology is a anything like a BAL cytology. Okay, a BAL, bronchio arrow lavage cytology. It becomes a liquid based cytology. But you are asking me liquid biopsy. Liquid biopsy is what? It's a peripheral circulating tumor cells. That means, what happens sometimes is there's any patient who is suffering from any tumor. Okay, this is a liquid biopsy. It's a liquid biopsy. So any patient suffering from any tumor will have some cells, will have some cell that is actually coming out in the peripheral blood. So nowadays markers are there which can identify those tumor cells circulating in the blood itself. And that is called as circulating tumor cell, better called as liquid biopsy. Better called as liquid biopsy. Krupel life at, I think there is some mistake in writing down. Please check it yourself in the Google also once. Different type of special name cells in anemia and leukemia chapters. So, Mr. Bhargav, there is already that in my Telegram group. So I will also again share that from in a Telegram group, so that again you can get that in a written format. It will be more easier for you that way. Okay, MDS finding. चलो MDS देख लेते हैं. देखो, what happens is MDS basically is a myelodysplastic syndrome. So any sort of dysplasia. What is dysplasia? A cell which is not normal. देखो, my hand is like this, but if my hand become like this, ऐसे टेढ़ा हो गया ना, it becomes dysplastic. So any cell which is not looking like a normal cell becomes a dysplasia. The problem is when these cells come out of the bone marrow, they destroy and hence causes cytopenia. They cause what? They cause cytopenias. They cause cytopenias. Okay. So MDS will have all the finding. MDS blood picture, MDS blood disease. You'll find there is dysplastic cells. For example, look at this one. If you look at this one, there is a bilobe neutrophil. Neutrophil, should have trilobes. It has two lobes. It becomes a dysplastic find. It becomes a dysplastic find. Similarly, there can be this one. It's actually a megakaryocyte, or it can be erythrocyte. It can be erythrocyte. But what you're seeing is a binucleate erythrocyte. Two nucleus again becomes a dysplastic feature. So anything which is not a normal feature becomes a dysplastic feature. The problem is they cause cytopenias. The cells decreases. The cells decreases. Okay, guys. Thanks for watching. We'll again do a session like this, maybe a more planned session, so that you can have plenty of doubts in front of you, and I can maybe cover in a better way. Okay, thank you, good night, and take care. Bye bye.